Don't eat so much sweets. No, don't put that much sugar in your coffee. You will get diabetes. Haven't we all heard these phrases in our lives? But what is diabetes? Does eating sugar or sweet alone cause diabetes? Or can you prevent diabetes by just not eating anything sweet? So today in this video we will learn all about diabetes. We will see what diabetes is, what are the causes and symptoms of diabetes, and we will also go through the diagnostic test for diabetes and learn more about different types of diabetes. So let's jump right into it. Let's start with what is diabetes. In simple terms, diabetes is a disease that results in too much sugar in the blood. But how does this happen? As you know, your body gets energy from the food you eat. The food you eat is broken down into sugar, also called glucose, and is released into your bloodstream. But your body can't turn this glucose into energy when it is in your bloodstream. So, when the glucose level increases in your blood, your brain gives a signal to the pancreas to release insulin. Now, insulin is a hormone that helps in carrying the blood glucose into your body cells, and it is here where the glucose is used as energy. Now, what if this doesn't happen? Well, it will result in the accumulation of the blood sugar in your bloodstream, leading to high blood sugar condition. And this can happen either because your body is not able to produce enough insulin to carry out this process, or your body is not able to use the insulin it makes the way it should. In other words, your cell stops responding to the insulin. Now you know what diabetes is. So let's move on and see what are the risk factors that may lead to diabetes. First is weight. If your body has a lot of fatty tissues, then your cells will start becoming resistant to the insulin. In simple terms, your cells will stop responding to your insulin. Second comes genetics or family history. The chances of getting diabetes are more if your parents or sibling have diabetes. And third is inactivity. When you are physically active, your body uses up the glucose as energy, and it makes the cells more sensitive to insulin, and physical activity will also help you to control your weight. So those were some of the risk factors. Now let's see what are the symptoms of diabetes. Symptoms of diabetes include increased thirst, frequent urination, fatigue, extreme hunger, and blurred vision. Please note, these symptoms will vary based on the person's blood sugar level. Now you may ask, how will you get to know if you have diabetes? Consult a doctor if you suspect you are showing diabetes symptoms. Sometimes these symptoms may go unnoticed, so a regular health checkup is also advised. Your doctor may ask you to get your blood sugar level tested to confirm your condition. Some of these tests are A1C test. The A1C test measures your average blood sugar level over the past 2 or 3 months. If your A1C is below 5.7%, then you're normal. If it is between 5.7 and 6.4%, it shows that you're pre-diabetic. And if it is 6.5% or higher, it shows that you have diabetes. Fasting blood sugar. This measures your blood sugar after an overnight fast. If your fasting blood sugar level is 99 milligrams per deciliter or lower, it is normal. And if it is between 100 to 125 milligrams per deciliter, then it shows that you are pre-diabetic. and if it is 126 milligrams per deciliter or higher, it indicates that you have diabetes. These are just two of the many tests that can determine whether you have diabetes or not. So now let's move on and see the different types of diabetes. So basically there are three types of diabetes: type 1 diabetes, type 2 diabetes and gestational diabetes. Type 1 diabetes is caused by an autoimmune reaction, which in simple terms means that your body will start attacking itself by mistake, and that will stop your body from making insulin. In type 2 diabetes, your body is not able to use the insulin it produces in the way it should, and is not able to keep your blood sugar levels normal. Gestational diabetes. It is developed in pregnant women, and if you have gestational diabetes, your baby could be at higher risk for health problems. Gestational diabetes usually goes away after the baby is born, but it increases the risk for type 2 diabetes later in life. To learn more about these different types of diabetes in details, stay tuned with ArogyaDrishti. ArogyaDrishti provides you an easy and convenient way to organize, access, and share your medical reports at your fingertips.